to all our warriors out there, and welcome to the Scleroderma Foundation's California Sclero-Sun podcast. My name is Tina Berger, and I'm the Patient Services Director with the Foundation. And with me today is the amazing Alejandra Serrano, Patient Support for the Foundation. We are honored to invite Dr. Brett Thombs and Marie-Eve from SPIN, the Patient-Centered Intervention Network. Dr. Thombs founded and directs the Scleroderma Patient Intervention Network, and Marie-Eve, I always say this wrong, I'm sorry, is the co-director of SPIN. And we were just talking about how we say it out here and how they say it out there, so my apologies for that. Before we get started with some of the questions, we'd love to have you both introduce yourselves and share some of your professional backgrounds and what led to developing SPIN. So can we start with you, Dr. Thombs?
Yeah, sure. I am a psychologist, so did my doctoral degree in clinical psychology at Fordham University in the Bronx in New York, and after that went to Johns Hopkins, where I was a postdoctoral fellow and actually worked with people with severe burn injuries on an inpatient unit and afterwards. And when I came to Montreal to work with at McGill, where I've been since 2006. There wasn't a burn unit associated with McGill, but somebody asked at one point, said, we have a scleroderma research community here. Would you be interested? And there's actually quite a few things that are similar in experiences between people with burns and the skin ramifications of people with scleroderma. So I, jumped on the opportunity, and now, 20 years in, I'm really proud to be part of the scleroderma community.
That's wonderful. I've always wondered what led you guys to get involved with scleroderma, because it's not something that you hear very often. And being this is still considered, a rare disease and not as, you don't hear it like lupus and rheumatoid arthritis. To know that you guys have taken such a special interest in scleroderma and made such an impact everywhere, all over the world, in my opinion, for the things that you've been able to do. So that's wonderful. So that's how it all started, huh? Getting involved, and somebody brought it to your attention.
Yeah, that's how I got involved in scleroderma, and I can share a little bit about how SPIN got started after once Marie-Eve introduces herself.
Thank you. Okay.
Yeah, so I'm Marie-Eve. I've been working with SPIN since 2013, but before that, so I have a master's in anthropology, and getting into the world of research, I think came because I enjoyed so much doing my own research during my master's, so I just transferred fields basically. So I started to work in perinatal mental health before, and then transferring into Brett's team in 2013. So I was completely new to the world of scleroderma, never heard of it before, but then got completely, fell in love with the community and with, my job and with, helping people. This is a big thing that I really enjoy, like knowing that we're making a difference.
A huge difference, by the way. And, you said something that even Andrew said. He had never heard of scleroderma and could not believe how strong the community is. So it's kind of like something that you saw when you started getting involved as well.
Yeah, definitely. Yeah.
Thank you. So, Dr. Thombs, why don't you go into a little bit more about SPIN and how it came to be?
Sure. So, when I started working in scleroderma, there was something called the Canadian Scleroderma Research Group, and they collected data from people with scleroderma. And, I started doing some studies and looking at challenges that were faced by people with scleroderma. And as obvious to everybody, there's lots of different challenges. It makes life tough in a lot of ways. And so, after a couple of years, I thought, we could just go on documenting all these problems and more problems, and how deeply we're going to think we understand these problems, and no one's doing anything about it. But there really wasn't much research back then in a lot of areas. I mean, at one point, I got a little bit of funding from the Canadian Institutes for Health Research to pull together people who were actually looking at how people live with scleroderma, because back then most of the research was on the biology and the pathogenesis, but how people actually live with scleroderma. So I went out and I was eager. I was a young professor and got my first bit of money and went looking for all these people who had been written on how people live with the disease anywhere in the world. And I invited all three of them to come to Montreal. There were like three people who had actually researched. There was nothing going on in this. So we began to think about, what kind of things we could be doing. And that led, one thing led to another one. And now, gosh, about around 2010, we brought together a group of people. We literally had a big long table with 20, 25 people that included a bunch of people with scleroderma from Canada and internationally. They included people doing some research, some of key rheumatology and other medicine experts on the disease. And the idea was that what should we be doing to actually do something about this? And it's not easy because one of the issues with rare disease research is that there's not so many people in any one place. And if you are in one place, there are many types of studies. There's really critical medical pharmacology studies and, you know, others, stem cell studies, whatever it may be. And so it's hard to do studies in one place. We end up with, often end up with very small studies that don't have enough
Yes.
people to really tell us anything.
Agree.
So, we got her on this table and it was fantastic because there were really, some of the patients that are still with us today and they're working with us, were there and other people with some great ideas. And we came away with this idea that there are a few key tenets of this, that one is that we all need to work together internationally, that we can't achieve the things we can do by ourselves. And that's a key principle for SPIN. Um, The other thing is that even back then, it was a lot harder back then, but we decided we had to work virtually since we're doing it internationally, that no center has the resources to deliver programs and the kind of things we wanted to achieve on their own, face to face. It just wasn't going to happen. And working virtually was more difficult back then because
Oh,
we
yeah.
didn't have the ability to go into groups like this
Yes,
on Zoom.
I agree.
Um, yeah, so it meant something different. It was putting things online. Um, And so we decided right off the bat that we were going to set up a network that was going to be a real patient researcher partnership. And that's a really critical component that we aren't just researchers looking in on what people with the disease are doing, that we work together, to figure out what it is that we should be focusing on and what kind of our priorities we have, how to carry out research in a way that best meets the needs of people with the disease. And so we decided that that was a key component. It's a real partnership, that we were going to be international. And how are we going to do this? So one, Isabelle Boutron is a trialist from France, and she works with Luc Mouton, who's one of our key partners. He takes care of people with scleroderma in Paris. And Isabelle came with this idea, why don't you set up a cohort? And this means that we could basically, a cohort is when you follow people and you collect data from them going forward on an ongoing basis. And so we do that. We went out, we have now 7 countries, and hopefully we'll be adding an 8th one soon.
Wow.
Looking forward to figuring that out. We can have a big surprise announcement of what country that might be. Right
I
now
was
we're in,
just going to ask, but I'll stop.
well, no, we won't tell. We'll keep this. We're almost there. Right now we have Canada, the United States, the United Kingdom, France, Australia, Spain, and Mexico. Uh,
Wow.
and and so we decided if we follow people like this, we can learn more. We'll use this cohort to collect data that helps us learn more about problems important to people and how they're living with the disease. And it lets us have a framework for testing these kind of programs we want to develop because we do want to do things that we know work. And it's almost impossible to run trials or test them just like you would run a trial for a drug, but to
Yes.
do programs again at one site. So once everyone comes centrally into a cohort, we then have a great space and lots of people involved that we can actually go out then and see who's willing to help us test some of our programs. So those are the kind of but that kind of underlines our mission is to work together as partners with patients and researchers, prioritize what are the things that we should be understanding better, use our cohort and other methods like interviews and talking to people to learn as much as we can about these problems, developing programs to actually help people live better with the disease and address these problems, and then testing them in our cohort. And then finally, the last thing I would say what we do is we always provide any program we provide free of charge. So we look at ways to keep the expenses down, and that we can work with patient organizations like yours. You're one of our top partners, just a tremendous partner. What you've done in California is fabulous, and to make sure that people can access these programs, you know,
Yeah.
yeah.
I was thinking as you were talking, how long did that take? that's quite a process to get to where to where you're at right. Well, not where you're at right now, but what you just finished saying. What was that process? Months, years?
Well,
What was that?
it all goes in stages, so we learn things, right? I should say, by the way, I want to give credit to Maureen Mays from Texas because she actually came up with the clever name of spin,
She
which
did. I was going to ask that question. Who got that name? Or
well,
who?
Maureen was at that first table and came up with Dr. Mays and came up with this name. So that's just a credit her where it's due. Um, but things went in stars. So we were very lucky that Marie-Eve came on early in the process. And this illustrates how some things are just luck. Someone other researcher ran out of money, and we were happily able to hire Marie-Eve. And she's been here ever since and become one of the top biggest advocates for people and a great member of the community. Right, and it
Right.
started fortuitously. Um, but it took us a couple years, right? Because in Marie-Eve leads all this work, but every time we have over 50 centers. And so that involved, each of these centers getting ethics approval, which is sometimes no small task, having contracts in place for collecting data and things like this. So Marie-Eve ran all of those processes super efficiently, but it takes quite a while.
Yes.
And we began to collect data in this cohort around 2014.
Yeah, I think the bulk of like the first few sites were like between 2013 and 2015, but we started collecting, data in 2014. We still look, add a few sites, here and there, but the bulk of it was like in the first 2 or 3 years. Yeah.
And then, throughout, we're working on things. We're developing project ideas. We're building some of these programs that we know we want to test. And we started first testing, the first program we tested was the hand program that Maria was going to talk about. But that we started testing around 2017 or 18, Maria.
2018, I think. Yeah.
Uh, and now it's an evolving process. We've learned and we're still learning and how better to more effectively engage the community in what we do. Uh, we're going into different areas of uh, challenges and important issues for people with the disease. So it's an ongoing process. We have lots of people involved, and I think the one thing I should say is that, and you talked about the community here, that this has been so effective because we are part of just a robust and committed community. Like people give their time. People with scleroderma work with us and contribute in just huge ways. Some of the other doctors who are busy and have lots of other challenges contribute their time. So it's really been a community effort.
Yeah, and I remember when I first learned about you when I started working for the foundation, and I went on your website and I took a look at everybody. So you've got patients that are involved in your committees, you have doctors that are involved, researchers that are involved, and as a result, it sounds like you've come up with a lot of these things because I wonder kind of where the decisions came from to how did you learn that these are the needs of the community of scleroderma? Because you put some things together through spin that are life changing. So how did it? I hope I'm making sense. Where was that developed? How was that developed?
Well, and again, these things have kind of rolled out in different stages, right? So it kind of after the fact, it sounds like a nice, neat plan, but it really doesn't
Right.
that way. But some of the things are different. When we started this, we decided we wanted to, there's some areas where we were pretty clear we need some tools, in the programs. And so right at the beginning, some of the ones that were prioritized were hands. And that one we've developed and out there. That was, as actually developed by our partners from France, Luc Mouton and Serge Pojado, who's no longer with us. Joop Welling is a patient from the Netherlands. He would take the train to France. He's a wonderfully talented amateur videographer and work with them. So that was one of the ones that came at the beginning from the first big table and the things that unfolded there. Um, the idea of an intervention to help people cope with looking different from other people. You walk into a room and you're the only one with expertise on this, and yet you have this unwanted attention sometimes. So that's one that works for building. And one of the ones that came up right away is something called a self-management program. And it's a terrible name because it's not managing by yourself, but they have these line of programs across diseases that mean self-management. But it really means becoming really more skilled at working with your health care team, helping to become a player in the decisions rather than just, receiving what someone else thinks you should do and identifying what the challenges are and dealing with some of them on your own when it's appropriate and knowing when to get health care. So that one And that one's interesting because right off the bat, I remember, some of the researchers were saying, well, they have self-management programs on other diseases. Maybe this isn't so important. And I remember stepping out in the hallway with a couple of the patients, Karen Gottesman and Maureen Salve, and said, which interventions matter? They said, we need a self-management intervention. And boom, that's how that one got into the pipeline, right? And Maria will talk about this again later, but we just finished a trial of that after it was a tricky rollout over years. And Tina, you were involved in that.
Yes.
Successful results from that. So other things we've done, we did a survey a number of years ago.
That's what I was actually going to say. So I do remember after I started working for the foundation and I was invited to talk to patients at clinic at UCLA, a lot of them were doing these surveys or these questionnaires. I don't know if this is where you were going, but they loved being able to talk about what was going on. And your questionnaires, I think, were very in depth to really capture the needs of patients. I even believe you did something for the family caregivers also. So you were able to capture information, and did those surveys play a role in putting these things together as well?
Yeah, so we actually did a survey, asked people what we should be researching, caregivers, family members, and that gave us some good ideas. And then, some of the stuff comes just right from patients. We were doing some research on pain, which is often ignored in scleroderma. Look at people with scleroderma have as much pain as people with arthritis, yet it's not researched. But think about in arthritis, it's coming from joint inflammation. In scleroderma, there's about 20 things that could be causing.
You said it.
So we had a project on pain. We're working on it. And the patients that were part of that research team said, why are you doing this with pain, not itch? You need to be doing this with itch too. No one's doing anything. And there you go. So we had another project idea that came right out of our patient partners. And then how do these become reality? Well, we have a steering committee that oversees everything. It has, patients involved. It's about almost half patients, researchers, healthcare providers. And then these ideas go to there, we discuss them. And then, in cases like that, now we're working on itch. So
that's great. Yeah, that's a big one. And other communities, I don't think, can truly understand how difficult that part of scleroderma can be. So that you're actually addressing this must mean a lot to the scleroderma communities. Yeah, that's
well, hopefully we're trying to get some good answers.
Yeah. And you're still doing these surveys. I know people today that have been doing them for years. That are the questionnaires, at their doctor's offices. And I know that you're doing this everywhere. I know you're doing it throughout the United States, right? And the other areas that you guys are covering in Canada and the other countries, right?
Yeah. Yeah, no, exactly. As Brett said before, so the 7 countries we have, approval to recruit people through their rheumatologist or their internist. So once they're recruited and enrolled in the cohort, so this is the questionnaires you're talking about is when people are part of the cohort. So that's one way of contributing to SPIN is being part. And some people have been answering questionnaires since 2013. So it's once every 3 months. And we have the ability or the capacity to change questionnaires. So it's not like they're going to see the same questionnaires over and over again. So we are able to, if we have a new idea for a study, we'll include a new questionnaire in there. So the questionnaires are changing over time. But yeah, so this is what people, and we have questionnaires in English, French, and Spanish because we recruit in all, these countries where, those different languages are spoken. And yeah, so that's one way that people, and we get this data, and then we look at, what are the challenges that people are going through in their daily lives, and this gives us, ideas on what to study next. And we also, as you were saying before, the survey that we did a few years ago to find, new topics, what do people want us to study? And oral health came out of this survey. And we also sometimes do focus groups. We do interviews. And so for when there's a need for this, we would put a call on social media. So people would know, if they're following us on social media and they want to get involved, this is how they could, know that we're looking for some people with lived experience to let us know what it is to live with something specific. For example, we'll have one very soon about Raynaud's and stress. Mm-hmm. So we'll put a call out for people who are experiencing Raynaud's and might think that, stress is triggering it. We're going to need their input and feedback to start the process of this study. And there's another one on physical activity. So we'll be looking for people who enjoy being active and some people who hate it, because we want, a large range of, diverse experiences. So that's how usually we try to include and to get, patients' perspective, in addition to our steering committee and also specific patient advisory committee, like when we have a new project, like I just described for Raynaud's and for physical activity, for example, the ones that are coming up very soon.
Yeah, and it's interesting when you talk about the physical activity, the ones that like it, the ones that don't, and the ones that did and now struggle as a result of what Scleroderma has, put in their path. So that's a good one. We talk about the problems that people have with fatigue, pain. There's all these little areas, and they always want more information on that. And so it kind of leads me to specifically asking you how the patients get involved. I know that you said one of the things that you do is on the social media, on the platforms of like Instagram and Facebook, and we always hear from you. We send it out to all of our support groups and get them involved. And so those are some of the ways that you're trying to reach the people. But how do I say this? Getting everybody involved on the different levels, whether it's background, your committees. Do you guys have like a board of directors with your group? Is that what your committees are behind the scenes? I know you have patients involved with that. Do you put something out letting people know that you're looking for more people behind the scenes versus the ones that are helping with some of the, the surveys and getting involved with some of the areas that you want to put together? I hope I'm making
I would say there are like 3 levels of like involvement. So the steering committee is like what oversees everything. So we're not actively recruiting for this committee, but it's like half researchers, clinicians, and half patients. So this is like decision making for everything SPIN does. Then the other level is like the smaller patient advisory board, like project specific that I was talking about earlier. So for these, we would put a call out on social media. And then for the participation level, for either the cohort or, being part of focus groups or interviews. So for the cohort, it's through their rheumatologist, if they're a SPIN, collaborator or recruiting clinician. But if not, it's also possible to get enrolled via us in Montreal. So they would just have to send us an email to spingeneral@gmail.com. And then we would see if they're close to a center that's recruiting for us. And if not, there's a way for us to enroll them in the cohort.
And one thing that Maria mentioned, if I could expand on, the steering committee, those people usually come from people who've already worked with us in other capacity, so we know them pretty well. It's a high level decision making group. But the second level she talked about was these patient advisory teams. And that's a really, I think, great opportunity, because these are small groups of, say, 6 to 8 people with scleroderma. And what happens, like Maya said, there's 2 coming up. There's a Raynaud's and stress and physical activity. We've had these, had them for pain, for itch in the past. So whenever we're starting on an area, we know we want to do research in this area. We know that people have prioritized it. And then we sit down, and the SPIN researchers who are going to work on the project meet with that team of patient advisors together, and go over the topic, go over the what they think is most important about it, what we need to know about it. And the key thing is, it doesn't, almost anyone with scleroderma can do it. You don't need to know. Like, we bring our skills together. So patients are the experts on their experience with the disease. We have great people with their research skills and methods, designs, and so forth as SPIN, and we come together. So you don't need to know anything about research. Really, what you have to do is you have to have scleroderma. You have to be interested. You have to be, willing to share about it and work well with a group of people, and that, get along. And that's all it takes. And we want all kinds of people with scleroderma. We don't want everyone who's the same. We want people who are different from each other, so we can get their perspective. And those advisor teams have really big impacts on our research. And it would be easy to name some places where they've changed our studies or really shaped our studies. And so it's a really important role that all it takes is really the want to do it kind of attitude, right?
Yeah. I couldn't agree more, and we'll get into it in a little bit, but even what I witnessed as being part of your spin self and the different personalities, the different levels of the disease, the different areas that are people from, the different support systems, and how everybody came together. And not only did they learn from each other, but I learned from them as well. So, so that leads me to the next thing that I wanted to ask you about is the different programs, Spin Hand, Spin Self, Spin Sled. And between the two of you, can you guys shed some light on those for us?
Yeah, sure. So I think what I'll do is I'll share my screen so we can also show people what the programs look like. So I'll start with the Spin Hand program. So as Brett mentioned before, so Spin Hand was the first program that the team kind of thought about developing. It came from Luc in Paris and Serge. But it's also, I think it's hand and fingers involvement is so common in scleroderma. So I think that's probably one of I wasn't there at the time when the idea came about, but I was there for the development of it. And this became kind of our platform and what every program we develop looks like. So what they decided to do was to create 4 modules. And I was going to say, so there were clinicians, experts, but also patients involved,
Yes.
of course, as, in everything we do. And so they decided to focus on 4 different area of the hand to
Yes.
create exercises that were specifically designed and targeted for scleroderma hands. And when you go to a module, so when you open it, so you can see the exercise, you can see so you have the video, and it's like, as we were saying before, so Joep Velling from the Netherlands went down to Paris, and he's a patient. He filmed some patients from Luc who accepted and agreed to perform the exercises. So we can see, real scleroderma hands performing the exercise. And then depending on your hand involvement, you can choose the exercise that is for a severe hand involvement or mild to moderate. So I don't know, I don't want to play it necessarily.
Pouce à sa base. Écartez votre pouce.
But you have like the video, you have the transcript of the video. So if you've watched it a few times and you don't want necessarily to, watch it again, you can just read the transcript. And then you have pictures to avoid common mistakes. So what not to do to make sure that you don't injure yourself, but that you're actually improving your hand function. And so there is also a place where we created some routines and also a goal setting, form that you can set goals for yourself to make sure that you go through the exercises and that you kind of develop a good habit of exercises. And so we did trial this through the cohort. So this was only the online, like self-guided program that people were, experiencing. And so we randomized, I think, over 400 people.
Wow.
To try it. The uptake was a bit less than we thought it would be because it's like, I think we realized that it's a bit like going to the gym, right? You subscribe to the gym and then when you're by yourself and you maybe lack a bit of motivation. So it was, the uptake was a bit less than we thought. But still we decided, to provide it free of charge to everybody, like the tools.spinsclero.com website, which I was just, logged in, on is free of access and everybody has access to Spin Hand right now. So that's something that was really important to us as we do with, all our programs.
I think we should remember that because this is a great tool, especially when somebody's newly diagnosed and this is a whole new process for them, reminding them of Spin Hand. I've forgotten about it, and I think it's something that we should make sure that the families know about because I think this would be a great tool for somebody when they're navigating, scleroderma for the first time, and maybe their hands are getting involved. And as you know, some people it's very quickly, very aggressive, and for some it's over time. And it sounds like through your surveys you've been able to put something together that addresses the different levels of people with scleroderma. So this is really nice, and I'm glad that it's out there and free. It's all something that they can access for free, and
exactly.
I want to make sure that we will have that information so people can access it also.
Yeah. We can send you like the email address that I gave earlier and this website so people can have it. Yeah.
Great.
And the other one that will be eventually, available also for free to people. We did the trial for the self-management program that Brett was also kind of describing a bit earlier. And when the results are written, we're going to put it, out there and people will have access to it. So I'll share my screen again. I'll show you the modules for this one, because I think that's what's interesting. So this was also an online program, but based on the experience that we had with Spin Hand, of people maybe not accessing as much as we thought they would do during the trial, at least, we decided to pair this with a group experience. So people would have access to the Spin Self intervention or the Spin Self program online, but would also go through the program together to learn the skills and the practical skills and learn how to better self-manage the disease all together during 8 sessions over the course of 8 weeks, and learn to set goals and learn to change some habits, to better manage some of the symptoms. So these are some of the modules that we have. So it says recommended here because when you do the test, like kind of the quiz of like what's important to you and what symptoms, what challenges you have, it recommends you a few ones in priority, but you still have access to everything. But those ones are showing up first. So we had skincare, emotions and stress, healthcare, coping with appearance changes, digestive system, fatigue, itch, pain, and sleep. So people grouped together to support each other through the experience would go through the modules and set some goals for themselves. And we were very happy to learn, looking at the results, that the intervention is actually effective. So people were better self-manager after going through the intervention and the modules. So we are very happy to learn that, and we're excited to make it available to everybody soon enough.
I think it's wonderful. I say that when somebody is newly diagnosed with scleroderma, this should be something that's ready for the patient as they exit their rheumatologist and they sit down at the computer and they sign up for this. That's what I think should happen.
I remember you talking about the newly diagnosed, and that should be something that's, kind of almost mandatory for them to go through. And we hope eventually, because the group format of it is very interesting for people who, feel isolated, or someone who's newly diagnosed. And we're going to try to provide that, broadly, and, kind of partner with associations like yours to be able to offer this to people who would like to go through the program together with other people, and having like a peer support, a peer leader as well, so that there's someone, leading the group that's either someone with scleroderma or someone who was trained to lead those groups.
Yeah, it's amazing. What was amazing for me is to witness the group come together, and there's always a few real enthusiastic go-getters that really set the example for a lot of the other ones, and they kind of looked up to them and wanted to reach that level because they showed them how it can be done. Some people are immediately very detail oriented, and others and it also depends on what everybody's going through in their life. So to have this support system, all your little cheerleaders in your group together, and everybody high-fiving each other on the things that they've been able to accomplish or learning from that other person, to witness that was just beautiful. And it is something that will make them not feel alone, having a group of people that they can go through this with, because a lot of them are trying to navigate this with their family life. And while their family is trying to be supportive, nothing beats another person that can finish your sentence. I say this all the time. So,
well, I can finish yours then, Tina. How's that?
What?
I'll finish your sentence then. How's that? No,
yes.
But you were one of the leaders who facilitated this, who did a great job. And one thing I think Marie-Eve is going to talk about the Spin Sled trial program next. But one of the things that made us so easily able to have like really qualified peer leaders is that we already had this program, Spin Sled. So many people had already been trained to be support group leaders, which is different from leading a group where you're trying to change your habits.
Yes.
But then it was just another little piece to take some of our, best support group leaders or people are really keen to do it, and then add this little piece, and then now they could facilitate these groups in the self-management program really effectively. So kudos to you and others
Yeah.
who did that.
Thank you. It was an honor.
You've done the spin sled program first, which we haven't talked about yet, and then we're able to ease into doing leading self-management groups, which is really great.
Thank you. And I'm glad you said that. And you know, both myself and Alejandra went through spin sled. So, and I still remember when I first came to the foundation, I said to the director, where's the training for our leaders? Because we need to help them be their best. And, you know, a lot of it is acquiring the skills over time. That's what our support group leaders did. They were sort of on a boat, in my opinion, without a paddle. And then here came your program, and it was in a phase of what was it before it went live to everyone? The pilot, I guess it was, and we had reached out. We were under National at the time, and I remember them saying that we were interested, and that's where I was introduced to you. And you let a couple of our support group leaders do that pilot. And then we had a meeting for all of our leaders where they talked about the experience and how much they loved it. And then when it went live for everyone, all of our leaders started going into it, and it changed their lives. And for a couple of our old schoolers, they'd say, we don't need this. We've been doing this for a really long time. And but I said, humor me and take the course. And they come back to me and say, you know what? We always think we know everything, but there are the wonderful moments throughout that training. And I also call it a support group for support group leaders, because we go through things as leaders also. And this gave us all a platform to talk about some of those things that we go through also. So I just wanted to say that. But I'll go ahead and let you guys speak more on that program now.
Yeah, well, no, I think the points you made are really important, because the shared experience, like, of support group leaders, you know, because this community, it has a lot of support groups, which for a rare disease, I think is uncommon.
Yes.
And so people rely on these groups, but leaders, it's a big job, right? So, and then most of them have the disease too, and, you know, it's a big job to lead a support group. So I think, yeah, the idea came about of like, we need to give these people, you know, the information, resources to help them feel more comfortable, for the burden to be lessened, and so for them to feel more confident and to be able to contribute to, you know, a positive experience for everybody in the group. And so we created this program with some patients, with Laura Diaz, our wonderful trainer. It's a 12-week training program that goes through, you know, how to lead a support group, how to structure it, how to recruit for new members. And as you were saying, to share the experiences, you know, between support group leaders. So some of them were potential group leaders, like maybe thinking about starting to lead one, and others were like really old ones who were not sure that this was going to help them or not. But over the course of, I don't know, 5 years, maybe now, 5-6 years, we've trained over 200 support group leaders in Canada, in the States, and in Australia, and in Quebec, and in France too, because we had some French groups too. So, and from this, because we had so many graduates, we decided with you and with Chicago as well, and Washington, to kind of create this leadership academy where graduates from the SLED program could meet and keep supporting each other and discuss the challenges that they have, you know, through their current groups, together with Laura, the facilitator for this. So we offer it twice a month. So there's like 2 meetings a month, but it's the same meeting. So basically people, like graduates, can attend one or the other. And so far, so we started last May, and so far we've been having, so Alejandro could testify on this, because you've been taking part in these meetings, but I think they're really appreciated, and they do, you know, keep people in touch and updated on, you know, what's going on in their groups.
Yeah, absolutely. And it's interesting. when I first came to the foundation, not only was I working, to organize the support groups, but I became a support group leader. And the way that I learned was I'd go to the support groups and I'd take little bits and pieces from these amazing support group leaders and help shape the leader that I was. But it wasn't enough. And not everybody can do that. So when your program came about, it was so wonderful. And I want Alejandra to speak on this too. I've met people from all over the world because of you guys that are my friends now, leaders. And then I'll see them in the academy and go, hey, it's me. We haven't seen each other in some time. And now we're in the academy together. People that I would never have known if not for your program. And so it's really nice. And what's really interesting is meeting people from all these different areas, but we still have so much common understanding about what we go through, whether you're in Australia or Canada or here in California. We all really learn from each other, and it's like a great friendship with everybody. And we commend each other. We're open, we're honest, we're vulnerable. I broke down once. Here I am, a part of the foundation, and I'm supposed to be strong, but I had a day that it was being hard on me, and I was allowed to be myself and be vulnerable in that meeting and have the fellow leaders rally and be supportive to what I was going through. And I do the same for others. Alejandra, can you speak a little bit about what you thought of that training and still do with the graduate program?
Yeah, so the training to me was amazing. I had just started being a support group maybe 2 years in, and through the training just helped me so much understand more of what I wanted to be. I have met other leaders that were doing support groups for years, but like Tina said, we can go to their meetings and learn, but to have a program and see what other people from Canada, the UK were doing just helped me so much. I still talk to most of them. Some of them passed away already, but I still talk to them. And even in the spin sled, I love attending because we share what we're going through as support group leaders. There's problems that we have in our meetings that I can share with my co-leader, but just getting an opinion from someone else that might be going through the same thing and how they were able to manage what they were going through just helps me so much. And I love attending. If I can attend to both meetings, I will go to the both meetings. I'm happy there. And I get to see different people every meeting that I go.
Yeah. And Laura.
Thank you.
Laura,
yes, I love
her. She makes us laugh. She understands just exactly what to say. Everybody loves her. We are so fortunate.
And we talked about some luck in getting to where we are. And, but it's interesting because Robert Riggs, who used to lead the National, and Maureen Salve came to Montreal. She was with Scleroderma Canada. We were putting together this program so it would meet the needs of the organizations. But Robert said, you should talk to Laura Diaz at some point about what you're doing. And, a few minutes into my conversation with Laura Diaz, I realized I should have just talked to her about how to structure the program. And I asked her, would you be willing to be the trainer? She was clearly, even from hearing her talk about support groups, it was clear this was the person. And she's just a superstar in this way and has been with us doing this ever since. And I'm, eternally grateful to have that, lucky chance to meet with her and get her on board for that.
Yeah, I couldn't agree more. I met her at a conference, and she did an opening speech to a lot of the leadership for Leadership Day. And I remember telling her, I want to stuff you into my suitcase and take you home with me because she's so amazing. And I really did. If I could, I would have, because that's what I think of her. And that's what everybody else that comes in contact with Laura thinks, is she is amazing and very insightful and very supportive. So you got a great one when it comes to Laura.
For sure.
Thank you. So we talked a little bit about spin self and spin hand and spin sled. But Alejandra brought up something to me that we didn't have on our list. And Alejandra, I'd like you to talk to them about what that is.
So there is one additional program you created, and I would like the audience to hear more about it. So you developed a program during COVID that helped a lot of the warriors, and I'm one of them because I was able to get all the support and all the information I needed to go through what we were going through with COVID. Can you share more about it?
Yeah, I'd love to. It was wonderful. We'll never do that again, but it was wonderful. So, COVID hit obviously, so late March of 2000, mid to late March of 2020. And, per our motto, one of the first things we did is we called a meeting on Zoom with our, key people that we work with all the time with Scleroderma. And we all agreed that we should try to put, given all what we do, we should try to put together a program. And usually we do these in the context of research. One, because we want to know if they work, and two, because it helps us fund these things. Like the first rounds of it get paid for with research money. So this is what we did there. But it was a ridiculous race because in just a couple of weeks, we went from having this idea that we should have a program, working with our patient teams to put together the format of the program, getting experts involved to deliver it, getting patient leaders to lead some of these groups, getting money to deliver it, and then scheduling. You can't even, maybe you can. I imagine all the moving parts that were going on, and we had a fabulous team. We had a team meeting one time. We have a Zoom screen with probably 30 people on this Zoom. That
We made a T-shirt out of it. Remember, we made a T-shirt.
Yeah. And so, but what the idea was that what we decided upon with our patient teams that we had 3 times a week, so it was pretty intensive, right? And the idea was that it was mostly is managing, it's coping and stress in COVID, early COVID people. And so it was a combination. So the leaders for that one also, each group was led by us, one of our trained support group leaders. And then each session we bring in some experts for mental health. So it'd be part support group and part learning about how to manage mental health. So we had people that were doing just anxiety management. I think Danielle Rice from the university did that. Gassana Babaki from University of Quebec Montreal did like meditation and breathing. There's a team from Calgary, Nicole Koulos-Reed and Amanda Wirtz's team that look at staying physically active and moving, during COVID. Laura Diaz did kind of dealing with all the information that was coming to people. And I'm maybe missing a couple of.
I know that. Yeah, there was I remember we used to say Laura D and Laura B because
Laura
there was. Yeah.
was doing right. Say thank you. Was doing kind of activities to say keep that you could do at home. So we put those things together, and it went on. Each group lasted for 4 weeks and 3 times a week. And talking about what you both said about staying in touch. At the end of a 4-week program, and at the end, people said, "Well, can we keep in touch with our groups?" And we said, "Well, that's for the science of it, that's not part of our trial. You can, but if you say in your groups that you want to exchange emails, we'll happy to facilitate and do that." And we did supply the emails, I think, to all the groups. Wanted that, and then people we hear all the time, many years later, are still in touch. And the thing, apart from the great program that was built and delivered, there were people from 12 or 14 countries that were part of these groups, whether it be New Zealand, Australia, the Philippines, Europe, North America, just everywhere. And so I think people, like you said, I think Tina, and got a chance to meet people from all over the world, and they've stayed in touch. And this is actually a really great example too of why it's so important to work closely with patients, because when COVID started, apart from this, we also had a new little cohort. We started collecting data on people's mental health very, much more frequently than we do in our regular program. And so we're doing that. But we started the Spin Chat program that been talking about. When you're doing research, you have to decide what your primary outcome is. What's most important to address. And all the researchers, we thought we would have definitely done like a depression and mood and loneliness. And our patient advisors right away across the board said, no, we know how to cope with being alone sometimes. We're sick. That's not a problem. Everyone is anxious and scared because this is a disease that with our autoimmunity could be fatal. You need to be talking about anxiety in your program. That needs to be your primary focus. And okay, so we did that. We did as they told us. I mean, don't why you get advisors? You don't listen to them, right? So we did what they told us. And what's interesting, I was talking about we were collecting data on the side, and what do you know? In scleroderma from prior to COVID to when it started, depression and loneliness didn't change, but anxiety shot up. So that's just an example. They had it dead on right, and what we need to be doing, we would have gotten it completely wrong without our patient advisory teams. So again, just another great example, I think, of we're working together, researchers and patients, and everyone who cares a lot about the community on all around, coming up with the best solution possible by working together.
It was beautiful to watch it come together and the different things that you had at each meeting. And if I remember correctly, nobody ever missed. It was 3 times a week. They were there 3 times a week, and the different parts. And I remember watching faces change throughout the program. Very scared and stoic in the beginning, and then a little looser, and then some joke cracking. And, we ended up having a great time. And I at one point, some of your sessions had us sharing about different recipes. And you guys developed a whole cookbook as a result of that. I mean, that was really cool, and some would show pictures. We wish that we could eat them, but we couldn't. And I even did some poems about my 2 groups when we were ending. And I know Alejandra can speak on this, but when it was over, it was kind of like, what do you mean? I can't, nobody wanted it to end. They wanted this to continue because friendships were developed as a result of this. And people from all over. I had Germany, Norway, Canada, different areas of the United States, UK. It was amazing to see, again, people from all over having the same issues during the pandemic and what it brought, to the table. Some that had support systems at home, some that had none, and how it changed lives. And I still keep in touch with them. We meet on Zoom. We have an open Zoom meeting, and if you show up, you show up, and if you don't, you don't. And we just catch up. And again, I've met some in person, and they're not just patients, they're my friends. They are my dear friends that I am really honored to know. And Alejandra, she can speak on that as well.
Like Tina said, after it was done, it was like, what are we going to do now? We was used to going 3 times a week. And like Tina said, having fun, creating recipes. I know once we did poems, we also did like a picture that we were going to all put together. And like Tina, our group continued to meet the day that we will meet, that we would usually meet. We continued to meet because we wanted to keep going. We wanted to see what everyone else was doing and how everyone was coping with what was going on in their different countries. And I love it. Like I said, I still am in contact with most of them, and seeing how we all started almost 6 years ago and how we are today is just amazing.
Yeah, it is. And again, because of you guys, this would have never happened. And you did it so quick. I remember when it came out, and I remember thinking, gosh, I hope I can do this justice, as being one of the moderators. And but I learned from the other ones that came in to do the mental health and the breathing techniques, and everybody really looked forward to it. And it was just great to watch everybody get to know each other and become like this little family during these sessions. It was beautiful. You guys did a wonderful job on that, and we couldn't thank you enough. And it just goes to show how much heart you guys put into the scleroderma communities and making sure that people have hope. That's what you're bringing, you're educating, you're bringing people together. You put a lot of time and effort into it, and it's beautiful, and people feel it. And a lot don't know until they get involved, but we can attest to the work that you've done and the impact that you've made all over the world, and it's the truth all over. You know, some people are like, I want to get into these things and I'm willing to say whatever it takes to get in, you know, but yet it's research at the end of the day. And there are, you know, specific criterias. And so that was an interesting one too, when some people weren't able because it's, you know, you have to put a research, I don't know, button behind it. And there has to be specific things that are captured. And I don't think everybody understands that, but it's because they heard how everybody else was doing and they wanted to be a part of it, you know?
Mhm. So nice to hear those comments. So we really appreciate because we do put a lot into it, both both in
I
the
have
heart.
videos that I haven't shared full videos with when we wanted you guys to know, and when we did the foundation celebration several years ago, and we brought you on and we talked about how much we appreciate what you did. We had little itty bitty inserts of it, but it was nothing compared to their stories and the changes. And so I think I should make sure that I share them with you in their entirety so you can really see the impact of what you guys have done for people, because they grabbed my heartstrings when I read some of them. And you haven't had a chance to hear that yet. So I'm going to share them with you. Okay.
Love to, yeah.
Thank you. So, last question. What's your plans for the future now?
Well, we always have a lot going on, and sometimes I think we forget it. So when we've been going through the things we've done, I think, oh gosh, yeah. So we have we have a fabulous team, by the way, all sorts of people from young students. I mean, young meaning undergraduates to graduate students. And Marie-Eve leads the team, and there's postdoctoral fellows, and there's people all over the world, right? There's doctors in other places. So we have this wonderful, wonderful just collaboration that lets us do that. But so one of the things we're going to work on going forward, we're still working on programs. So we're working on one that I mentioned early on that we still have in the hopper is a program to support being comfortable with yourself and walking into rooms when people are going to recognize that you might look different and not know why, and looking at body supporting body image. That's what's been developed by Vanessa Malcarne out in San Diego, who's a professor there in your zone of the world in California. So and a wonderful, wonderful long-time spin collaborator. So that's one thing. Another thing that we're doing that I think is really exciting that I like a lot is that we involve patients in research, but it's also important whether or not you're involved directly with us. We think that people can grasp what's going on in research. Everyone talks about research, and research is good and what's going on. Now, sometimes people are less positive about research, depending where, but they all, but how can we communicate? Because sometimes what you do is fairly technical. You brought in some aspects of who's eligible can be in a study and but how can we communicate that effectively to everybody? So we're actually studying that because we really do believe in research. So if we have questions, we research it. So now we have, we had a patient virtual research event in November
Yes.
that attracted several hundred people came online to hear about research, not just spin research, but research from groups around the world. And we actually, we did that as a trial. So some people went to a room with just researchers presenting, some went with researchers who were co-presenting their work with patients who'd been involved with them. So we're testing that. So, because we co-present most of our research. It means we go out in front of audiences, we go with a patient member of the team and a researcher, and we talk about it together. The experiences they had, the patient, why it was important, how it became to be, and then we can talk about more of some of the methods and what we found and so forth. And we're also looking at, we have this great program. So right now, I love this program. It's the patient's pick. So it's, which we comes out. So if you're in the cohort, pay attention. If you're not in the cohort, contact us and and get you in. So the patient's pick has two purposes. One is that, some patients that work with us pick out the most recent research that they find is going to be really interesting to patients, not just spin, but anywhere. And we send it out. So we put it in a format that's easily accessible for anybody, right? So we put it in a plain language summary or a whatever other format. And then, and then we get in. The second part of this is that the people who see what we've done give us feedback on how well we've communicated, so we can learn. Because we want to be better at communicating about research to people who are not researchers,
Yes.
and we want to be able to teach other researchers how to do that. So everyone can be well. So we're working on those kind of things. Maria, I've mentioned we're doing. Some of our team is working on Raynaud's and whether or not it's often assumed that stress might cause Raynaud's attacks, and it could, but we don't really have any evidence. So we're actually going to design a study to figure out
That is so
to what
great.
degree, stress in the course of a day might make you more vulnerable to attack or not, and we'll hopefully get a good answer on that. And so there's always a lot of different studies going on, and we try to pedal as fast we can, with lots of people on the bicycle, right, working together and get as much done as possible to address things that are important
Yeah.
to people living with this disease.
Yeah, I have to say, I can't tell you how many times I'll talk to somebody that's going through something and they're like, my Raynaud's is through the roof while I'm going through this trial in my life or this anxiety and so you really hit it with this. This is really going to meet the needs of people that want to understand more about how our body reacts to stress. And many of our families living with scleroderma, they talk about Raynaud's being a big culprit of when they're stressed out.
Yep.
Yeah, my dog's trying to get into the picture. I'm trying to get him out. I'm sorry. Yeah, this is wonderful. And I love what you're doing with the research and putting the two groups together. It kind of reminds me of when I would go to investigator meetings for clinical trials as a research coordinator. And when I first started going to them, it was all foreign to me. And it took years of me going to these investigator meetings and watching and taking notes and learning and sitting with the doctors when they would be in the room with the patients to understand some of it that was above my scope. So what you're trying to do to bring a patient perspective in and allow them to understand is really great. And to do these two groups to see how and you're helping researchers understand that, which is really important too. So that's phenomenal, and I'm really looking forward to your additional information on that in the near future that you've been setting up to talk to us about that.
Great.
Yeah. Anything you guys want to say in closing?
No, to get involved. If you're out there and you want to be involved in any of this, we'd love to have you. And if you have any good ideas for us, let us know.
Great. Thank you.
I
Well,
would like to add something if I can, Tina.
yes.
So, as a scleroderma patient and as a support group leader, I would like to thank you guys for everything you guys have done, all the amazing programs you guys created, because it has helped me so much. Like I said, I still attend the spins chat, and I love it. And I'm learning every day. I learn something new. Every meeting that I attend, I learn something. And even if I'm going through with my scleroderma or in my personal life, it helps me so much. So thank you for everything that you guys are doing for
Well,
us patients and the leaders.
Yeah.
well, thanks for being with us.
Yeah. Thank you. Thank you for being so authentic and really caring about the scleroderma community. It shows. And we hope you know how much we love working with you. It's an honor.
Well,
Okay.
it's mutual.
So thank you.
Yeah.
Thank you very much, you guys.
We love the California group. So,
Thank you. And we love you.
oh,